Well, what we know is that there's still COVID-19 circulating in our communities. We'd actually enjoyed a period of time where the COVID cases were relatively low, but we're seeing those numbers increase. And so, really, what we would like for parents to know is that it's important to protect your little ones, and being vaccinated really protects children from getting infected with COVID as well as the severe complications from COVID-19 infection.
And doctor, how can families travel safely with children during the summer?
Well, we know that summertime is time to get out and enjoy travel, spend time with extended family, and being safe is very important. I know that I have traveled and had to seek emergency services with little ones, and that is not very enjoyable. So we recommend that when you're traveling during the summertime, that you continue to wear your mask, that you continue to take all the safety precautions that we were taking earlier in the year to make sure that we're able to keep everyone in the family safe, not just the little ones. So masking, frequent hand washing, and just taking those safety precautions, of course, avoiding those who are sick. And if you or your little ones are experiencing any symptoms, to really stay away from others who may not be sick.
Right. And, what do people need to understand about the possibility of these new variants or subvariants?
As long as COVID-19 is circulating in our communities, there is an opportunity for a new variant or a new subvariant to come about. We've seen that from the very beginning of this COVID-19 pandemic, and we've gotten all the way to Omicron, and now we're seeing subvariants of Omicron. And these Omicron variants and Omicron subvariants tend to be more infectious than the original versions of COVID-19 that we were seeing earlier. So really taking those safety precautions to prevent infection is really going to be key. Masking is very important. Of course, vaccination is also very important because we know that individuals who receive the COVID-19 vaccine and those who are adequately boosted really do lower their risk significantly for severe infection, severe illness, and death from COVID-19.
So, doctor, just to verify, the current vaccines will be effective against these new variants and subvariants.
With the information that we have currently, all evidence shows that the current vaccines will be effective against new variants. But of course, that's something that we're watching. We will begin to see over time if there will be any waning immunity or if there'll be a new variant or a subvariant that may develop that may be able to evade the vaccines. Of course, we in the medical world are hoping that we don't ever see that day. But we do understand that researchers are already looking into making modifications for the vaccinations to be able to continue to protect individuals when that time arises.
And, the CDC has eased those mask restrictions for most Americans. And what does this mean about the current state of the pandemic?
The CDC has relaxed the masking requests and requirements for a lot of communities. And I think that it is safe for us to enjoy not wearing masks for a period of time. It is, however, important to know what COVID-19 is doing in your community, or if you're going to visit a certain area, to know if COVID cases are on the rise in that community. We just heard here this week that New York City is seeing a rise in COVID cases, and they are starting to now request that individuals and suggest that individuals wear masks in indoor spaces again. And so we just have to remain aware and stay on top of things because we know that this infection does spread rather rapidly. And of course, we don't want to be in a position that we were in earlier this year where we had record number of hospitalizations and record deaths from COVID-19.
And doctor, speaking of protecting our children, authorization for vaccines in children under 5 still currently under review. What do parents need to know about that?
Yeah, whenever we talk about approving vaccinations for kids, that is just a much more stringent process. The FDA is evaluating the research studies for individuals, and we are hoping to hear soon something about vaccinations in children under age 5. However, we did hear this week that the FDA did recommend booster doses for individuals who are age 5 and up, a single booster dose once individuals have been 5 months out from receiving the first two COVID vaccines.
All right, very good. And doctor, one more thing. What does the future look like with COVID? Will we need to get vaccine boosters every year, just like the flu shots?
That is something that we are still currently looking at the recommendations for. It's likely that we will have to do some yearly vaccinations for COVID-19 just to really account for the different changes in the virus. We want to make sure that we're able to keep everyone as safe as possible. Of course, we don't want individuals to require hospitalization or death from COVID infection.
All right. Thank you so much for being on our show, doctor. And where can folks go for more information?
Yeah, so anytime you want to get more information about COVID-19 vaccines, you can go to vaccines.gov. There is a wealth of information there. Also, if you are concerned about where to be vaccinated, you can enter your zip code and it will give you a location for vaccinations that is usually within 5 miles of where you live.
All right. Thank you once again. And here's to a great summer and being safe. Safety first. And of course, for more on this information, head to firstcoastliving.net.